Everybody excited, happy?
We'll be out tomorrow.
Oh, yeah.
Happy tomorrow?
Marketing day tomorrow.
Oh, stop being so fearful. She's only one person. All right, so I'm Dr. McKenzie, and we're going to be doing the Ruminant Respiratory System. Where's my class president? So I'll be here today, tomorrow. Dr. Kopich will be here on Monday to finish up her stuff, and then I'll be back on Tuesday. So I will pretty much follow the syllabus. Yeah, pretty much follow the syllabus after that. All right. So Ruminant Respiratory System. All right. So, before we get started, so this should be on Blackboard. Does everybody have it?
Oh, yeah, it's the fifth one. It ends in 05.
Ends in 05.
Yeah.
Yeah, it's a number.
There's
Yeah.
numbers, they're not actual names. Yeah, it ends in 05.
Yeah. Well, I did my best. That was the first time I've ever put it on there by myself. All by myself. So, hopefully you find it. If not, let me know. All right. So we're going to start the Ruminant Respiratory System today. And basically, this lecture is going to follow a similar format to what you've seen from me in the past. Couple weeks ago. And so you have the syllabus, and it does look like a lot of material because it is, but as far as what we're going to cover in the lectures, so Brandon, you're right, I am going to use this. I didn't think I was going to use it. So just to show you, so you don't panic, you're already stressed about how much you have to do. But as far as what we're going to cover in these lectures, we're going to divide up the respiratory system into upper and lower respiratory tract. So as far as upper respiratory tract, we're just going to do those diseases. We're going to try to do it, systematically. So we're going to start in the nasal cavity and work our way backwards. So that's what we're going to be covering in the upper respiratory system. All right, so nasal cavity, sinuses, pharynx, larynx, and trachea. And then for the lower respiratory tract, we will cover this. So we'll probably start on the diseases maybe tomorrow. And I'll go over this again, but I'm just starting off like this just to make you see that you should not panic, don't panic, just follow along. So those are going to be your lower respiratory tract diseases that we're going to cover. Sure. So let's see now. There's 61 people in the class? Or 59? Yeah. So, all right, so encourage your folks to come to class. And I know 8 o'clock is tough. It was hard for me to get here this morning, but encourage them to come. Some of them are in surgery? Yeah, so that's probably where some of them are. All right. And then the rest are just not here. So try to make it to class. I was looking at late night television last night because I have time. You guys don't. So they had these Seinfeld reruns, and yeah, I'm a Seinfeld nut. So anyway, so they had. Well, I won't describe the episode to you because something's kind of racy, I guess. But in a funny way. But racy, yeah, R-A-C-Y, racy. But anyway, so the female character is dating a doctor, a medical doctor, but he won't call himself a doctor until he passes his boards. And I thought that was kind of interesting. Is that interesting? I thought it was interesting. Because she's trying to boast that she's dating a doctor and says, no, I'm not a doctor yet, I haven't passed my boards. So I guess that's a veiled message to you guys. No pressure, no pressure. Next year this time, everybody's going to be passing their boards, right?
Yes.
All right. So without further ado. All right, so examination of the ruminant respiratory system. So typically we start off with a history and physical exam. So all of you were out there with me in the pasture earlier this semester, so you know that I stress a lot about the history and physical examination, because what you're doing is you're trying to develop, or you're trying to gather clues as to what might be going on with the animal. All right. So the history, you're all familiar with age, breed. So the signalment, age, breed, gender, etc. Main or presenting complaint, duration, onset, progression, spread. What you're trying to get at with this set of questions in the history is whether the disease is just a single entity, or whether it's affecting more than one animal, or whether it was introduced into the herd, or whether it's spreading through the herd. And we kind of arbitrarily divide these lectures into non-infectious and infectious. So typically you think of diseases spreading when you talk about infectious diseases. This semester we're doing non-infectious diseases, but it is a concept that you should think about whenever you're presented with a single animal. You should always be wondering, especially if it's a herd animal like a cow, you should be wondering if there's other animals affected in the herd. Some other factors, and I'll show this more later, probably tomorrow. As far as your transportation stress and feedlot stress, that's a big factor when it comes to respiratory diseases in ruminants. Okay, you're all familiar with the term shipping fever. So they're loaded up on a truck, they're shipped, they're driven many miles, either in a truck or in a train, and just the act of gathering all those different animals together from different points of origin, putting them in a confined space, and traveling long distances involves certain stresses. Right now, for example, we have a little Holstein calf in the back. Did it die?
No, she's still good.
Oh, good. Okay, so we do have her, so she's still alive. So there was some things in her history, bought at a sale barn. So right away, she's mingled with different animals, different ages, might be harboring different diseases, and they're all being mixed together. So that creates its own sort of stress. So those kind of things you're going to pay attention to when it comes to getting your history. The feedlot stress, the reason we're starting a little late today is because I was trying to find the feedlot slides. So let's see, should I show them now or later? I'll show them later. Well, I guess I can show them now. But let me just finish the history first. Accompanying systemic signs, so things like weight loss. What that is cluing you into is that the animal has a systemic disease. Yes, it might have started in the lungs, but it's affecting the rest of the body. And you remember when I was lecturing you a couple of weeks ago, I spoke about everything being interrelated. Even though for convenience we break these lectures down into body systems, everything is interrelated. So you're presented with an animal with weight loss, and you're examining it, and you're hearing crackles and wheezes, elevated temperature, and so on. So the pneumonia, so it might have pneumonia, but it's also feeling bad, so it doesn't feel like eating, so it's suffering from weight loss. So everything is related. Some management factors that you'll find when you talk about the ruminant respiratory system. The animal might have recently been treated. It might have been dehorned, for example. recognize once you've done a few dehornings that you have some sinuses right under the base of the horn, the corneal sinuses, and those connect with frontal sinuses, etc. So the animal can develop sinusitis from something as seemingly unrelated as being dehorned. All right. So let's see, I guess this is a good place to show my feedlot slides. Yeah. So the reason I like these feedlot slides is because they star Tuskegee students. So I took some students to Mexico 10 years ago. I wouldn't do it now. Yeah, you guys are a handful. But it was fun. I enjoyed it. So this is a feedlot. It looks like any other feedlot anywhere in North America, I guess. This just happens to be in the northern part of Mexico, outside of Monterrey, Mexico. We went to the University of Nuevo León, and I took 12 students with me for a week. Stress. Yeah, talk about stress. So anyway, so this is a feedlot. You can see it's flat, it's wide open to the elements. You know, it's a little dusty. You know, and so it's a good environment for them to pick up, for cattle to pick up infections. You see basically no shelter, very typical of what you'll see in a feedlot situation. So these are the students. So the feedlots will have, you know, these silos that they have different sorts of feed in. So these are Tuskegee students here. Who is this here? No. That's my twin brother in Mexico. Yeah. My Mexican twin. Yeah, we kind of did look alike at a distance. We did. Yeah, he kind of looks like me in this picture. It's not me. And I'm going to take pictures. So they'll have silos to store the food, and then you have the cattle. So these cattle are coming from all over different parts of the country, and they're of similar ages for the most part, but they're all being mingled together. You can see the environment that they're kept in, dusty and exposed to elements. And you can see some of them here looking at you. And these are the trucks that they're loaded onto. So you go from this environment where you may or may not be incubating disease, and you're all mixed together in the truck. You guys have seen these trucks going down the highway, right? Yeah. You're not around, you see them all the time. You see them all the time, zooming past on the highway. So yeah, so they're mixed together, and it's a good environment for creating, for incubating disease. You have these feed troughs, and later on we'll talk about certain diseases that may be associated with feed troughs, just the mechanical act of sticking their head over and pressing their trachea up against the edge of the feed trough. We'll talk about that a little later. And different breeds of cattle. If you guys saw this breed at a glance, what would you think it is? Yeah, it has some Brahmin traits, doesn't it? It has some, you know, relatively long ears, not as pendulous as a Brahmin, but, you know, probably Bos indicus is somewhere in the genetics. Does have a pendulous dewlap. So yeah, it's Bos indicus related. And here again, you're just seeing the many different breeds of cattle. And here you see them in the act of feeding. So they'll drive down the road and they'll put the feed in the troughs, and then that's a signal to the cows to come over and feed. So again, one thing that we'll talk about in a second, when you're trying to evaluate if animals have a respiratory disease, is you're going to examine the feed. So you see how they're holding their heads down to eat. So we'll talk about that in a second. And they'll also have a sick pen. So this was one of the sick pens that they had. So the animals that are showing, you know, signs of disease, they'll put them in this pen. But the pen is, you know, fairly close to the feedlot, but it's somewhat separated from the feedlot to try to at least provide some level of isolation from the rest of the animals. And that's just showing you another one of the feed bones. I swear this is not. That's my good friend. All right. So that's what I wanted to show you concerning the feedlot. So bear that in mind, because there's probably tomorrow or next week we'll be talking about some diseases that are associated with a feedlot. So you'll have that picture of a feedlot in your mind when we start talking about those diseases. So your physical examination, remember when we were out in the pasture, we spoke about observing animals at a rest from a distance, and that's when you can note their normal respiratory rate. And how many of you guys have finished your chart with cow, horse, pig, goat, not pig, goat, dog, cat, and then you have the TPR. So you have more or less an appreciation of what the normal respiratory rate should be for ruminants. So, these are just rounded off figures. You don't have to memorize this. Just be aware of if you see an animal with a respiratory rate of 100, but that's abnormal. All right? One of the clues, so earlier I spoke about gathering clues from your animals. So typically we talk about increased inspiratory effort from upper respiratory disease. So upper respiratory disease is everything up to the lungs, but not including the lungs. So your sinuses, pharynx, larynx, trachea. And if you observe the animal closely, it has to inspire and expire. And if you liken it to some narrowing due to inflammation in the upper respiratory passages, so they're having to overcome that narrowing, overcome that resistance with an increased inspiratory effort. So sometimes if you look at them closely, you'll get a clue as to where the site of the disease might be, if it's upper versus lower, just by looking at their effort to breathe. Is there a long inspiratory phase showing increased inspiratory effort, or is there an increased expiratory effort? Some of you that were in clinics a couple weeks ago, when we had the RAO horses, recurrent airway obstruction horses, you'd note that they had an increased expiratory effort. They were trying to push out to breathe out, and in doing that, they were tense in their abdomen, and you saw the hypertrophy of the abdominal muscles and so on. So this can give you some clues as to whether the disease is upper respiratory or lower respiratory. So what I spoke about a while ago about examining the feed and water containers, this can give you another clue. The animals are hanging their head down, and if they have a nasal discharge, and then they're hanging their head down, then it's going to come out into the feed and water containers, and you'll see that. Or you might see blood in the feed and water containers. Okay? So the history of physical exam, you're gathering all these clues, and then you are going to restrain the animal and begin your hands-on physical examination. All right? So you want to try to do it more or less systematically. Whether you start at the nose, work your way backward, or start at the chest, work your way forward. Just try to develop something that works for you, but make sure that it's repeatable, that you're going to do it every time that you examine an animal. So your respiratory system physical exam, you're starting, so I'm starting at the nose, looking at the nose, nostrils, mouth. I'm also looking, if there is a discharge, is it unilateral or bilateral? If there's a nasal discharge, is it unilateral or bilateral? Because that gives me a clue as to where the source of the discharge may be, if it's a little further back in the larynx and pharynx, or whether it's in one of the nasal passages, for example. So unilateral or bilateral. Also, I'm making note of airflow. So you might see me, for example, holding the back of my hand up to each nostril, and what I'm doing is checking to see if there's any obstruction in the airflow from one nostril versus the other. The breath odor, so they're ruminants, so they have relatively sweet-smelling breath, compared to carnivores or humans, for that matter. Some humans. So breath odor. So what you'll learn with experience is that, for example, if you have an anaerobic bacterial infection, it's going to smell very foul. and you'll be able to detect that on the breath odor. So if they have an anaerobic pneumonia, for example, caused by anaerobic bacteria, then you'll be able to smell that on the breath. And also the mucous membrane color, you know, they have to be really deoxygenated for you to see changes in the mucous membrane color. But if you do see it, then that could be a clue that you're dealing with a respiratory disease. Percussing the sinuses for resonance. So certainly if you suspect the animal has sinusitis, so it comes in with a history of recently being dehorned, and it's febrile, it's feeling sick, so it's not eating, so it's off feed, and it has a purulent nasal discharge. You're going to be percussing over the maxillary and frontal and corneal sinuses to see if there's some dullness in the resonance in those areas. And when we talk about those diseases, we'll mention that again. Palpating lymph nodes on the head and neck. So you remember when we were up in the pasture, I said that I don't routinely do that unless I can see that the lymph nodes are enlarged, and then I'll palpate them to see how enlarged they are. Otherwise, you know, they don't usually like you to spend a lot of time palpating their lymph nodes. They tend to resent that. All right, so we've done all of this. So the first thing that a lot of students will do is they'll auscultate, and that's fine if you remember to also do this. But you know, a lot of times with inexperience, when you're asked to do a respiratory exam, you're just going to auscultate. But I also want you to be aware of, you know, looking at the upper respiratory passages, and you know, either before or after you auscultate the lower respiratory passage or system. Okay, so you're going to auscultate the heart and lungs. So you just have to go auscultate the